It's Wendy Blackburn, and I'm with a company called Intouch Solutions, and we do digital marketing exclusively for pharmaceutical companies.
Hi, I'm John Mack. My newsletter is called Pharma Marketing News, and I also do Pharma Marketing Blog.
Hi, my name is Silja Chouquet. I have an agency called Y-Dot and specialized in social media analysis and strategy, as well as a blog called Y-Dot Pharma. And I'm also organizing a weekly healthcare and social media in Europe tweet up every Friday, where we rally healthcare Twitterers around Europe to talk about what's going on in that space.
I've seen some Americans sneak into that too, you know.
Yeah. John is our special guest.
I'm Steve Woodruff with Impactiviti. I am a pharma blogger. I have a newsletter, blog, and various and sundry other things. In fact, on your table is a ridiculously sized non-business card that has a link on the back for pharma social media resources if you want. I also consult with clients on their social media strategy needs and play the role of matchmaker between pharma clients and vendors, helping clients find their ideal vendors.
All right, perfect. So there's not a terrible amount of structure to this section, so I have really hard questions here. I'm sure you have even tougher ones, so I'd rather see the audience stump the panel. So we're going to play Stump the Band today. So who wants to volunteer? Go first. I have gifts for volunteers also.
Oh boy.
So.
So the question I think is probably for John Mack and also
really? Steve
Woodruff. The FDA hearings are coming up next week. What is your best guess in terms of whether we're going to get guidance out of this? Because the last time they did this, we didn't get anything 13 years ago.
Well, if you go down there, you'll get my T-shirt, which says, I attended the FDA social media hearing, and all I got was this lousy T-shirt.
$29.99. No discounts for bulk ordering.
Do you think there's enough pressure now on the FDA?
Well, I went on record, I guess you'd call it, if you do a tweet about something, you're on record, that I predicted there will be some kind of guidance by the end of 2010. It doesn't mean it's going to cover every possible aspect of promotion via social media, but I'm pretty sure they're going to do something, and I think they already have something in mind, because they've organized this rather hastily, I might add. It's not as well organized as the last one was, and as you know, when they issue guidance, they have to have a public commentary period, and I don't think they would do this if they didn't have something in mind, and considering what happened in 1996, they would lose a lot of face if they did not come up with something this time, because I sure as heck won't let them get away with it without criticizing them.
Steve, you want to add? Anybody else?
My best guess is that they actually will come out with something. I think they have to. And based on the fact that they blew it in the late 90s and came out with nothing on the internet, now that we're at Web 2.776 or whatever version we're at, I think they will. And my hope is that they'll keep it very high level, that it will not be a detailed rule book, because so many things change with the technologies. I think there are just certain major things that have to be addressed, such as what do we do about information that's linked to other information? What do we do about two-way communications? And what do we do about shareable content? And those things will all transcend specific platforms. They should not say, here are the 28 things you should do on Twitter, because 27 of them may be gone in 2 years. So I hope they would not go that route and stick at a high level.
Do you want to, so you're speaking at it, Wendy, so I don't know if you want to build anything on that or just say move along.
I was surprised when the gentleman, I believe it was at the e-patient communication summit, I think it was last week, mentioned that they expect to have guidelines conservatively by the end of 2010. He kind of went on record verbally at least saying that, and I was surprised at that personally, because I didn't think they'd come out with anything that quickly. So we'll see, but it also, I tend to agree with John that they probably have something in the works.
Hi. One thing that I've wondered about is to what extent can we be smart and try to marshal patients, consumers, to try to, kind of get the ball rolling a little bit faster, a little bit more in terms of, the FDA coming out with internet guidelines. And I guess I'm saying this not just from a pharmaceutical perspective, but, in terms of getting more types of medical information, patients access to more types of medical information, be it advertising or other types of information like ratings on health grades and things like that. So I guess the question is basically, have you thought about how we could use patients to try to move the agenda along?
Well,
Right.
well, actually, I'm a little bit surprised by the question because patients aren't exactly sitting there waiting for FDA guidance. They're out there, and they're what's making social media so alive and such an interesting opportunity for pharma. So today, they're the most active segment driving social media in healthcare. I think the FDA hearing is to provide pharma guidance on how to use that opportunity better. So to your question, how can you prepare? I think one no-brainer at this point is get the adverse event reporting straight. It's not about whether you ought to or not ought to look at this. You have to report adverse events in any other media that you use, in any other activities, market research, clinical trial recruitment, etc. So, go work at that now because that's what you need. That's a minimum requirement to get in there. And start to look at what patients in your main disease areas are doing and saying about the disease, but also about your products, because I can bet you they are. So start finding out about that and see how you can provide value to that discussion.
Well, it's an interesting question because in 1996, I was at that hearing as well, and there were a lot more patient participants at that hearing, and I actually learned a lot from their presence there. And usually when you're at FDA hearings like this, communication about risk or something like that, and DTC ads, you will see a lot of patient organizations and patient groups. I don't know why there are so few participating this time around. It's almost like as if they're in two different worlds. You got, while patients are using social media a lot more, they really don't care what the pharmaceutical industry wants to say to them. They're busy talking, doing their own thing, doing their own content, and this is not their issue anymore because they're in control of the medium. In 1996, it was the service providers, if you remember. I mean, you couldn't do your own blog. You couldn't write your own website. So patients were really at the mercy of major service providers and other companies, and that's why they might have felt more of a stake in what happens on the internet. Now it's a completely different world.